Hi there, and thanks so much for joining me for this video. In this video, I'm going to review Module 50, which discusses schizophrenia. Okay, so schizophrenia is a type of psychotic disorder. So when we talk about psychotic disorders such as schizophrenia, essentially what happens is the mind becomes split from schizophrenia, such that one's own thoughts become divorced from reality, and they often experience what are called delusions and hallucinations, right? So literally, schizophrenia means split mind, okay? And the person who invented that term, Eugene Bleuler, spoke of a splintering of the functions that govern thinking, perception, personality, and memory, while also including things like emotion. And again, the most notable characteristic symptom of psychotic disorders like schizophrenia is a split from reality, or a lack of understanding of reality. Okay, so again, psychosis refers to a mental split from reality and also rationality. And schizophrenia includes a variety of symptoms such as disorganized or delusional thinking, disturbed perceptions, and also inappropriate emotions and actions. So let's take a look at those symptoms in more detail. So I don't know that this particular classification system is still in use among clinical psychologists, but I'm keeping it in here because I think it's the easiest classification system to understand. So when we talk about symptoms of schizophrenia, we can distinguish between positive and negative symptoms. But we want to be careful here because positive and negative are used differently. So positive symptoms aren't good or pleasurable symptoms, and negative symptoms aren't bad or, unpleasant symptoms. What we mean by positive is we mean the presence or addition of problematic behaviors that we wouldn't normally see. Okay, so these are additional behaviors characteristic of schizophrenia, whereas negative symptoms include the absence of healthy behaviors. So again, positive behaviors are additional problematic behaviors that characterize schizophrenia, and negative symptoms are a lack of healthy behaviors that we would normally see if it wasn't for the presence of psychosis. Okay, so let's take a look. Okay, so first we have hallucinations, which are defined as sensory experiences without adequate or without external causes or without sensory stimulation. So we would call them illusory or false perceptions, right? So seeing something that isn't there, hearing something that wasn't there would be an auditory hallucination versus a visual hallucination. And by far, auditory hallucinations are the most common. And usually those auditory hallucinations are persecutory, which means they are negative. They are telling the individual that they smell bad or that no one likes them, or sometimes that they should harm themselves, those kinds of things. But you can also have visual hallucinations with schizophrenia. as well as tactile um, hallucinations with schizophrenia. So feeling something that isn't there. You can also have olfactory hallucinations with schizophrenia, where you actually smell something that is not there. Okay, so hallucinations are essentially false perceptions that don't actually refer to or don't actually have a cause to them. Like sensory stimulation or something in the environment, right? So they're entirely false. But interestingly, when it comes to schizophrenia, if a person is having a visual hallucination, we see activation in the visual cortex of the brain. And we also see activation in the temporal lobes when they're experiencing an auditory hallucination. So even though these are entirely false sensory perceptions, they do activate the same brain regions that an actual sensory stimulus would. Another positive symptom characteristic of schizophrenia is a delusion or an illusory or false belief. And again, they're often persecutory. So individuals with schizophrenia often think that they're being persecuted, often by the government or by they're involved in kind of an illicit plot where they're being chased by some kind of an enemy or pursued by some kind of an enemy. And they also experience what's known as disorganized thought or nonsensical speech. When it comes to negative symptoms, which again refer to the absence of healthy behaviors, we often see what's known as flat affect, which is no emotion, at least as expressed in the face. We can also see inappropriate emotion in schizophrenia. For example, laughing when they're told something sad, or crying when someone tells a joke or something like that. We also see reduced social interaction and reduced feelings of pleasure. And we also see a lack of motivation or initiative, and an inability to maintain focus on tasks. There's also an avolition of, or a lack of speaking, for example, alogia, a lack of speech. And in very severe cases, we can even see what's called catatonia, which is the absence of movement. So how does schizophrenia develop? Typically, schizophrenic symptoms appear at the end of adolescence or in very early adulthood, though the presence of schizophrenia can sometimes be later in women than for men. Okay, prevalence. Nearly 1 in 100 people develop schizophrenia, and it's slightly more prevalent in men as compared to women. And when we talk about the development or course of schizophrenia, or the development of schizophrenic symptoms over time, we can distinguish between chronic schizophrenia or process schizophrenia and acute or reactive schizophrenia. Okay, so acute or reactive schizophrenia often develops in response to extreme stress. Okay, so it's a reaction to stress, and some people develop positive symptoms such as hallucinations. Okay, but often people with this form of schizophrenia, their prognosis is positive in the sense that recovery is likely. And this is compared to chronic or process schizophrenia, in which the symptoms develop much more slowly and they experience more of those negative symptoms, such as flat affect and social withdrawal. And in this case, the prognosis isn't as positive, unfortunately. So with treatment or support, there may be periods of a more normal life, but there is no cure. And without treatment, this type of schizophrenia often leads to poverty and interaction with the criminal justice system. Okay, so treatment for both chronic and process schizophrenia usually includes medication, either typical or atypical antipsychotic medication aimed at reducing those illusory perceptions and beliefs or delusions and hallucinations. It can also include psychosocial rehabilitation, okay, which is going to include an emphasis on life skills, okay, and kind of entering into society after the onset of symptoms. There's often psychotherapy, and it's usually family therapy and supervised group therapy. Again, with a lot of emphasis on developing daily living skills, developing a support group, and appropriate supervision to prevent, some of the negative outcomes associated with chronic schizophrenia, like poverty, homelessness, and interaction with the criminal justice system. But without these treatments, particularly with chronic or process schizophrenia, there once was an emphasis on institutionalization, but now we have things like outpatient treatment or partial hospitalization, which is more focused again on helping individuals with schizophrenia restore their mental health and stay involved and active in their communities. Okay, so there are a couple of different subtypes of schizophrenia. Paranoid schizophrenia is the most common, and it includes being plagued by hallucinations, often with negative messages, so there's auditory or visual hallucinations, as well as delusions. So some of those delusions might include feelings that one is supernatural or has some supernatural ability, or some, often there are messianic or religious undertones to those particular delusions. There is also disorganized schizophrenia, and it is characterized by more of those negative symptoms, so flat affect, incoherent speech, etc. And the rarest form of schizophrenia is catatonic schizophrenia, where they develop difficulty initiating or controlling movement. Okay, so what happens in the brain when we develop schizophrenia? Well, as we talked about before, an excess of dopamine in the brain or dopamine receptors often leads to those positive symptoms of schizophrenia, so those feelings of paranoia and hallucinations, which is why those antipsychotic medications, their mode of action is to decrease the amount of dopamine in the brain. There's often poor coordination between neurons in the frontal lobes, which results in impaired judgment and self-control. And again, we see that the thalamus, which routes sensory information throughout the brain, The thalamus is active during hallucinations, so again, it is as though real sensations are being received, even when the person experiences false perceptions or hallucinations that are not yoked to reality. And in general, there is a shrinking of brain areas and the connections between them, which can result in cognitive deficits like difficulty with attention, concentration, memory, thinking, emotions, and those sort of cognitive processes. Okay, so what are some of the risk factors that make one more likely to develop schizophrenia? Well, just like with other mental illnesses, if you have a low birth weight or you were deprived of oxygen during delivery, if your parent didn't have adequate nutrition while they were pregnant, or if your parent develops a severe infection while pregnant, like the flu, that can put you at risk of developing mental health disorders like schizophrenia. There are also genetic factors. So the incidence of schizophrenia is about 1 in 100, but that shrinks to 1 in 10 for individuals with a family member diagnosed with schizophrenia. And also adopted children, when we look at their risk, it tends to be related to the biological parent, which suggests that there's a strong genetic component. But rather than there being a single schizophrenia gene, schizophrenia seems to be influenced by a variety of different genes, and there's a lot of different factors that influence whether that gene is expressed or not. Okay, so again, talking about the heritability of schizophrenia, we see that in many, many different countries, your risk of developing schizophrenia is significantly higher if you have an identical twin with schizophrenia as compared to the risk you might acquire for a fraternal twin that doesn't share as many of your genes, right? So we see that the risk of developing schizophrenia, if you have a twin with schizophrenia, ranges from about 42% all the way to 65%. So it does seem that there is a strong heritability or biological component to the development of schizophrenia. All right, so that concludes my last video in week 5 talking about psychological disorders. If you have any questions, feel free to reach out, and I hope you have a wonderful week.